Welcome to the Lyster Health Talks podcast. Each month, listen in as the team focuses their discussion on relevant, relatable health content that empowers your health and the readiness of the force. We are very excited to introduce you to our new host, Lieutenant Colonel Leah Steder, the Lyster Commander and Health Services Director at Fort Novacell. In today's show, the team sits down to discuss emergency preparedness and the importance of having a plan. Welcome to the show, ma'am.
Hello, Fort Novacell. This is Lieutenant Colonel Leah Steder. I'm the new commander for Lyster Army Health Clinic and the host for the Lyster Health Talks podcast. It's a pleasure to be joining the show and continuing on the legacy that Lieutenant Colonel Holt left. For those of you that don't know, I am coming here from NORAD and NORTHCOM. I was stationed there for about 3 years, where I primarily worked with FEMA and Homeland Security in various activities, but most notably humanitarian response and disaster response. And conveniently, today's podcast is on emergency preparedness. As most of you know, we're about 2 months into hurricane season. We're fortunate enough to be close to the gorgeous beaches of the Florida Panhandle, but with that brings increased risk from flooding and tornadic activity during hurricanes. Regardless of the disaster or emergency, it's very important to have a planned response when you're at work, on vacation, or on the road. I have with us today guests Luke Stewart, Shane Cook, and Lieutenant Colonel Regina Thorp. Let's go around the room today. Tell a little bit about yourself and your background.
Good afternoon. My name is Luke Stewart. I am the Chief of Plans, Training, Mobilization, and Security, which houses the emergency management program for the clinic.
Good afternoon. I am Shane Cook, and I am the new Safety and Occupational Health Manager for the Lyster community.
And it's great to be back again. This is Lieutenant Colonel Regina Thorp, and I'm the Deputy Commander for Nursing.
Thank you guys for joining me today. Those of you that are from Lower Alabama or new to Lower Alabama are probably aware that we are about 2 months into hurricane season. Not just hurricanes, but natural disasters and things come up. So it's always good to be prepared for any type of situation that may arise. Often people like to create certain kits, and Luke's here today to talk a little bit about things that can be done to prepare ahead of time.
Yes, so it's always good to have a go kit, and even if we're not in an evacuation zone, we really don't get evacuated a lot. A go kit established is also a shelter-in-place kit if you need one. And you want to ensure you have certain things such as food and water. For food, you want to make sure it's non-perishable food. For water, it's always a good rule of thumb to have 1 gallon per person per day and at least a 3-day supply. Other things that you want to include in these kits is weather radios, flashlights, batteries, cell phone charger, a weather radio that's hand cranked. Also, you want to make sure you have medication on hand, preferably 30 days to 60 days, especially if you are evacuating, because you are not sure the location that you're heading to's capabilities to support you.
Hey, Luke, I think that's a great point. I think with that medication, I think it's also important to either have a list of your medications and or pictures of the medication bottles. I think having those on hand, especially if maybe you don't necessarily have that time to get those refills, you have that ability of the knowledge of medication. So when you're able to get those refills, calling that nurse advice line would be really, really helpful in that type of emergency.
Yes, ma'am. Also, with that is a consideration for any medical devices that you might have. Now, with those medical devices, things you want to think of is if it's an oxygen tank, do you have spare oxygen tanks? According to your instruction manual, can your device run off of a battery backup or a generator?
Another item I think is incredibly important to have too is cash. A few years ago, I was on a hurricane response, and we were hundreds of miles away from where the storm hit, and it was about a week before they got any power. So
yes, and in addition to cash, if you are evacuating any important documents that you might need, such as passport, birth certificate, social security card, you're going to want to bring those with you as well.
Those are all great tips, Luke. As the storm starts coming or any incident that does occur in and around the local area, is there specific ways that the community uses to communicate during a disaster or different radio stations that folks should be on the lookout for or tune into?
Yes, ma'am. So the Fort Novacell community, those who are employed on Fort Novacell and have a CAT card can register for the Alert Mass Warning Notification System, and they'll be receiving updates from post. If they live off post or they're members of the local community, the EMAs, the emergency management agencies for the counties utilize iPause, which is a mass notification system done through your cell phone. So if you've ever received one of those Amber Alerts on your phone, that's where it would come through. Also, they use emergency broadcast systems, so it would come over their TVs as well.
One of the other things that you need to be aware of is that the Fort Novacell community typically puts everything out on their Facebook page. So between Lyster's Facebook page, Fort Novacell's Facebook page, that's a wealthy source of information so that communities and individuals can keep up with what's going on in the local area, just in case there was an evacuation or something of that nature. You can keep in touch with what's going on because Facebook will be one of those primary sources of communication.
Well, that's a great point, Mr. Cook. Is that also where folks will go to start seeing if services are being shut down or curtailed, or the base is shutting down for access?
Yes, ma'am. That's the primary place that that Fort Novacell will put that information out. It's a quick and easy place, and it notifies you immediately through through your normal Facebook app. So, as long as you've got that up and you can keep track of it, then what will end up happening is that you'll be able to you'll be notified immediately when something changes within the Fort Novacell community.
Thank you. Lieutenant Colonel Thorp, can you talk a little bit about some of the other mechanisms that may be in place or other communication tools?
Absolutely. I think the most important thing is what is the severity of the concern that they have. Obviously, if it's an emergency, they need to call EMS or 911. Do not have ER capabilities here, so that is the most important thing. If it's something that can be addressed within the next 48 to 72 hours, our nurse advice line is a great resource to provide them with any of the answers to the questions that they may have.
Thanks, Gina. Do you have any other recommendations?
I think what Mr. Stewart had highlighted as a great resource is having that on hand of 30-day supply is very important. And so there's always that capability of, in addition to the nurse advice line, of sending a message through the Genesis portal, but understanding that if our services shut down, there won't be any of our nursing team answering that on the other end. So just understanding if there is a refill that's needed during that interim, that they may need to be calling that nurse advice line or going to the closest ER for that medication refill.
Thanks, Gina. Another option, depending on how far folks go, is TRICARE is still available. So we are through TRICARE East. They will know what facilities are still open and what facilities actually take TRICARE if you are a TRICARE beneficiary.
So that nurse advice line can guide you to the most appropriate pharmacy for those needed refills.
Mr. Stewart, I know that you've been a resident of the Wiregrass area for quite some time. I know that we don't hit a lot of hurricanes, but is there any other weather events folks need to think about?
Yes, so there's always the severe weather. Everybody knows during the summer in Alabama you get your downpours, which leads to flooding. So that's a consideration to be prepared for, especially with the roadways. And then, of course, tornadoes. We're usually at pretty high risk for a tornado during hurricane season, so it's always good to identify your shelter locations during that time and possibly prepare an area in your house that is a shelter location for a tornado, i.e. putting blankets and pillows in there, pre-staging a weather radio in there, making sure maybe not the comfort item for your child, but a comfort item for your child is in there as well.
Thank you. That's all very good advice. Mr. Cook, I think we've had discussions before where you've actually had to evacuate during a hurricane, and you were part of the response during Hurricane Katrina. Is there any other advice that you can give?
I think communication is key in understanding what's going on. Unfortunately, when a hurricane hits or when any type of disaster hits, there's going to be communication problems and issues. During Hurricane Katrina, I was helping out at a local Katrina relief area, and I ran into, or we found a mother and some children that didn't belong to her. She and her neighbor were actually on top of the roof, and when they got plucked from by the helicopter, her neighbor's children went with her, and her children went with the neighbor, and it was just through the power of television and news media that we were able to actually reconnect them. They were actually in Shreveport, Louisiana, and her children and the neighbor were actually in Houston, Texas. So it's just understanding, especially having your children, making sure that they know who you are, what their last names are, what their telephone numbers are, addresses, communications, things like that, so that if something happens and you do happen to get separated, they have a way to communicate with someone, law enforcement or emergency services, to let them know who they are so they can try and locate you.
Thank you, everyone, for joining today's episode of Lyster Health Talks. Before we close out, do any of you have, I'd like to go around the room, and if you guys have any other tips to offer or resources to offer.
Yes, ma'am. Alabama has a tax-free weekend for emergency preparedness, and this happens the last weekend of the month of February every year. And it includes items that you would have in a shelter kit, weather radios, flashlights.
That's very useful information. I'll be buying a generator myself next year.
Absolutely.
So one of the things that I'd like to bring up specifically is I know a lot of us use our cell phones for just about everything. There's a couple of things that are going to happen. Number one is that you need to make sure that your cell phone is completely charged. If you know that there's a weather event coming, if you see that there's a weather event coming, whether it's tornadoes, bad weather, storms, flooding, whatever, make sure you've got your cell phone charged. Make sure your kids have their cell phones charged. That way there's always an opportunity if we have cell service to be able to communicate. In addition to that, when communication goes down, having that secondary means of communication, having a rally point if you have to get out of your home or you have to or you have to go somewhere other than where you're at. If your home is destroyed by a tornado, having a rally point that your kids know to go to meet with one another so that you have that immediate notification and communication with your children. Or just your family. But those things are important to just understanding and making sure that your kids know like where that is. In addition to that is practicing. You know, we talk about things like if we do things in the military with drills and things of that nature. Well, it's also important when you're at home, especially when you're doing fire drills or emergency evacuation drills or tornado drills, just making sure they know where to go, how to get there, and making sure that there's nothing in the way to get there.
I think that's a great point. I didn't even think about that. Just practicing with my children, it's just going through those drills so that way if an event were to occur, they know exactly what to do. So thank you. And I think from my perspective, in addition to the health resources that we have and also being aware of Facebook, Genesis Online Portal, and the Nurse Advice Line, I think overall it's just looking at the resources we have for disaster preparedness. So that's, we do have the readyalabama.gov, which is tailored to any of the national disasters that may occur in Alabama, which is also linked to ready.gov. So it has a great list of checklists that you can go through with you and your family and make sure that you are properly prepared for any kind of event that would occur.
Thank you very much. That's all amazing information and very helpful. I know we've talked a lot today about hurricane evacuation. We are fortunate enough to be in a unique area. Yes, we are approximately 90 miles from the ocean, but the reality is we do have other storms that could occur, as everyone has said, like tornadoes, probably not a freak snowstorm like you would in the Midwest. Either way, weather is out there. Being prepared means being proactive and taking steps to ensure that you are ready for whatever comes your way. As we wrap up today's show, I'd like to leave you all with these parting tips on emergency preparedness. Stay informed on weather alerts. My favorite Facebook page for that is the Fort Novacel weather page. They do an amazing job of sharing weather updates for our community. We mentioned this already, but it's worth repeating. Be sure to store all important documents such as birth certificates, passports, social security card, insurance cards, whatever is important to you in a fireproof box, and that you know where it is in the event you need to grab it in a hurry. And the most important tip I can share is learn CPR. Every second in a cardiac event does count. By merely knowing the basic steps of CPR, you can save somebody's life one day. Thank you again to my guests, Luke Stewart, Shane Cook, and Lieutenant Colonel Thorp for joining this month's podcast. Be sure to catch us next month for another show that empowers your health and the readiness of the force. This is Lieutenant Colonel Leah Steder signing off. Keep 'em flying.
The Lyster Health Talks podcast is produced by the Lyster Army Health Clinic Public Affairs Office at Fort Novacel. You can catch all of our episodes on your favorite streaming platforms. Tune in next month as we sit down to discuss resiliency and how it relates to your health care. Stay healthy, Fort Novacel.